If you have a retinal detachment, is it inevitable that you'll get a cataract? Let's talk about it. Hi, my name is Zach Oki. I'm a retina specialist here in Irvine, California. The short answer to the question is no. That is unless you undergo a particular kind of surgery called vitrectomy, in which case it's guaranteed. There are many ways to repair a retinal detachment. We can laser the retina if it's small enough. We can do a mini gas bubble in the clinic, something called pneumatic retinopexy. We can do something called scleral buckling, where we tie a silicone band around the eye and squeeze a little bit. That will resolve a detachment. Or number 4, we can do the surgery, vitrectomy. To the extent that any of these things intervene on the inside of the eye, introducing something like gas or oxygenated substances on the inside of the eye, that's when we find the risk of a cataract forming. Relatively speaking, a vitrectomy is the most invasive in these terms. That is, introduces the most oxygenation and instrumentation on the inside of the eye where the cataract lives. Whereas with like a laser procedure, no one's opening the eye at all, therefore there's no oxygenation to change the status of the lens, which then leads to a cataract. Or if you have a scleral buckle is a silicone band on the outside of the eye indenting inward. No one's entering into the eye at all, and therefore the risk of a cataract essentially is zero in that case. So it really depends on how intensive and invasive and how much instrumentation is introduced inside of the eye that leads to a cataract formation. If we just study the subject of who gets cataract surgery after vitrectomy, the average time to cataract surgery is about a year and some change. Whereas if we look at people who undergo cataract surgery, let's say after a scleral buckle, it's almost like it's the same as anyone. It's the same as any average adult who is undergoing an aging process.